Yeah, thank you. It's Dr. Cliff Porter in support of Senate Bill 2458. So I'm the senior fellow with healthcare at Texas Public Policy Foundation, whom I represent. So to follow on what Senator Hughes said, Medicaid is very much in need of regular audits, both at the state and federal level. And the estimated overpayments and fraud in some states is actually over 30%. And so in the context of some of the recent revelations of some of the behavior of Superior Health Plan, for example, this is a timely bill to reveal how much the degree of there's not just overpayments, but on the broader category of fraud, waste, and abuse. So in many ways, there just isn't adequate auditing of the Medicaid currently the way it is, particularly in the the managed care organizations, are essentially like HMOs, fee-for-service, urgent care, ER, literally fee-for-service. But to reiterate, 95% of these areas are not being audited by the current RAC, the Recovery Audit Contractor. So in other states, we're seeing, like in New York, for example, they're estimating as much as $60 million a year was recovered. And then some of the research was done here looks like at least $4 million in the first year and up to $30 million in 2029 and 2030. So many other states, like California, for example, they're taking advantage of the Medicaid system and inflating eligibility so they can actually increase the reimbursement from the federal government. There's actually a disincentive to actually do auditing, because once they reveal overpayments, then quite often the state would have to reimburse that to the federal government, so they do not want to do it. So there's actually that disincentive, even though they're required by law to do it. So this would address a significant amount of that. So with the degree of saving that's coming up from these extra audits, until they're actually seen, people say, could there be duplicate audits? Well, once we find the audits, we can actually see to the degree of the problem. So I'm not afraid of duplicate audits. EMRs allow this stuff to be done actually fairly easily. Thank you.